The bluegrass state of Kentucky is known for its rolling hills, horses, and college basketball. But the beautiful state also has some people that struggle to afford medical care. For 9 days in August, residents near the towns of Manchester, Oneida, Annville, Barbourville, and Hyden welcomed medical service members from the Army, Air Force, and Navy that visited 4 different counties to deliver no-cost medical, dental, and optical services. The Department of Defense gathered together the resources for this large Joint Forces Innovative Readiness training event. Units from the Army Reserve Medical Command and the Air Force offered residents free medical exams and physicals, nutritional counseling, dental x-rays, cleaning and extractions, and eye exams. Dental and optical services were most popular. Although many participants had some form of medical insurance, many did not have coverage for eye and teeth care. Some patients had been untreated for long periods of time because of the high costs involved. Hardly anyone had an affordable way to purchase eyeglasses, and patients were eager to receive free eyeglasses provided by the Naval Ophthalmic support and training activity that crafted the lenses on site. Tammy Halcomb from East Bernstadt, Kentucky, felt very lucky to have her teeth treated and to receive new eyeglasses. She was appreciative of the helpful and eager attitude of the military medical staff.
They do know what they're doing, and they're happy to be doing it. You will save money, especially for the working man. There is so many people, had they known about this, especially the working class, they would have been more than happy to be in here today, and probably the reason they're not because they're having to work. And like I said, between the dental and the vision, I'm saving $1,500, $1,600.
Colonel Anthony Hanna, the commander of the Army Reserve's 7242nd Medical Support Unit from Gulfport, Mississippi, spoke about how valuable the training was to his unit. His soldiers treated real patients in a real community that would be just like their mission overseas to a foreign population if they were called up for deployment.
So the members of my unit oftentimes on what we call the reserve weekend would not get the full exposure to treating patients under the circumstances that they're getting here. Here, they're actually sitting down with a dentist and a patient and are actually doing the same types of skills that they've been trained on and the same at the school. And the experiences they got here will last for God knows how long, and making them highly trained and highly competent and proficient. And that's across the board for those that we brought that do eye techs, our dental techs, and our medics.
The local community was very supportive of the event and nominated more than 30 sites for the medical teams to provide services. Todd Hicks, a pastor whose church site was selected in Oneida, elaborated on his thankfulness.
Anybody that's put anything into this, I appreciate it from the depths of my heart. It's just been a generous, great thing. I'm so humbled just to say that I've got to work with you all. It's been a great class of people, and I can never thank you enough from the depths of my heart because of the red, white, and blue that still flies today.
Innovative Readiness training events are civil military programs that build a mutually beneficial partnership between the U.S. community and the Department of Defense to meet training and readiness requirements for active, Guard, and Reserve service members while addressing public and civil society needs. Senior Master Sergeant Darlene Groban of the Air Force's 111th Medical Group comments how this is the first time she has helped citizens of the U.S. as a service member, in contrast to all of her overseas missions.
This is the first time for me working with a community base that is in need like this. I've been overseas and things like that, but this is the first time that I was able to interact with the community, and it makes you realize what you've never seen before. So it was kind of like an awakening of what people need. So it's gratifying to help them.
Countless individuals told their stories and expressed gratitude for their services they received. Many have known each other for years in these smaller towns.
This has been great for the community. The dental program was amazing. That is very needed here.
I just think it's one of the greatest things that we've had. I am so thankful that you all got to come.
And I wish that we had really just took a loudspeaker and gone out and let everybody know.
You seem to do a good job, and everybody's been extremely nice and polite.
It's a great thing, and hope you come back soon.
Some participants were also able to interact with Vice President Pence as he came to Manchester, Kentucky to witness the military in action for this IRT mission. Reporting from South Central Kentucky, I'm Sergeant First Class Kenny Scott for AR Medcom Public Affairs.